Good day, welcome to NSC 525 Intensive Nursing Care. This course is designed to expose student nurses to knowledge and skills necessary in the care of patients who are critically ill and to enable them to further develop critical thinking skills and application of nursing process to patients in an ICU environment. My name is Fatukasi Bukola. I welcome you once again to Intensive Care Nursing. At the end of the course, students should be able to describe intensive nursing, describe intensive environment, describe the intensive machine monitors and instruments. You should be able to describe the ICU patients and their needs, explain principles of infection control in the ICU, describe special nursing care formats used in ICU and explain the prevention and other management techniques of common surgical infections. Now, introduction to intensive care nursing. As a way of defining this course, intensive care nursing, also known as critical care nursing, is a specialty of nursing that deals with the care of critically ill patients who require close monitoring and life-sustaining interventions. Intensive care nurses work in intensive care units, ICUs, where they provide round-the-clock care to patients who are critically ill, injured, or recovering from surgery. History of ICU dates back to 1940s, where the origin of ICU can be traced back to Denmark during the epidemic when Dr. Bijon introduced the idea of dedicated units for critically ill patients. He established the first intensive observation unit where nurses manually ventilated patients, saving lives. Then in 1950s to 1960s, the development of mechanical ventilators and advanced monitoring devices led to the formal creation of ICUs in hospitals. And the first official ICU was established at the University of Southern California in the 1950s. All the way to 1970s to 1980s, there were improved medical interventions and technology such as defibrillators and dialysis machines, which further defined ICU care. And from 2000 to present, advances in technology, including computerized monitoring and telemedicine, have continued to enhance ICU capabilities. Characteristics of an ICU environment. The ICU environment is distinct due to its focus on providing high-level continuous care to critically ill patients. And there are some characteristics that are basically peculiar to the ICU environment, which include advanced monitoring and equipment, multidisciplinary collaboration, high nurse to patient ratio. It is in the ICU you find 5 to 6 nurses to just 2 or 3 patients. Then critical decision making, specialized care protocols, 24/7 operation, that is, it is always in operation, stressful and emotionally intense environment, and limited patient interaction. What are the roles and responsibility of ICU nurses? Number one is assessing patients. Second is monitoring patients. Third, operating life support equipment and other medical devices, administering medications and treatment, documenting patient information, providing patient care, development of treatment plans, coordinating with other healthcare professionals, among all other roles that ICU nurses perform in the ICU. Summarily, introduction to ICU provides an overview of the intensive nursing designed specifically for student nurses. It highlights the key responsibilities such as patient assessment, critical care skills, multidisciplinary collaboration, operating life support equipment and other medical devices, among others. It also emphasizes the importance of communication skills and other ethical considerations in providing high quality care to critically ill patients. Conclusively, ICU nursing is both challenging and rewarding at the same time, requiring specialized knowledge, technical skills and emotional strength. So for student nurses, it offers a unique opportunity to make a profound impact on the patient's lives. The complexity of ICU care demands dedication to ongoing education and collaboration with the healthcare team. Thank you very much. See you in the next class.